TNT Open Mind Insights brings you powerful, authentic conversations illuminating the path to better mental health care for all.
Dr. Veronica Kelley, I'm so excited to have the opportunity to talk to you about all of the work that you do and what brings you passion into everything you're doing. I've had the good fortune of knowing you for a long, long time.
A
Um,
long time.
in some ways, I think from when you were close to at the beginning of entering your work in behavioral health, and now as a director of healthcare for Orange County, one of the biggest, cities, counties in the country. Uh, I, I'm just, that story and where you started and where you are now, and if maybe you could begin by just sharing a little bit about that path.
Sure. I'm a trained social worker, so I'm a licensed clinical social worker, and my doctorate degree is in social work. And I think I was really chosen for the field
Mhm.
by my family and community. So, coming from a family that experienced a lot of trauma, I
Okay.
think I was the one person in the family who the method in which I used to heal was really to lean into everyone's pain and sort of
Mhm.
help them process. And that sort of continued so that when I went to my bachelor's
Mhm.
program in psychology, when I heard about social work, it was like the clouds parted and the angels sang, and I just knew that was the space.
Mhm.
Um, After all my work and internships, I ended up where we met at UCI
Right.
and worked for the College of Medicine and really felt that was my space, working with
Mhm.
people who were living with a serious mental illness. And the field has really changed quite a bit, and in some ways hasn't changed at all. So I find myself very thankful to still be in the public sector
Mhm.
of behavioral health so that I can help perhaps inform and change policy.
Okay. Yeah. Um, and myself have being a psychiatrist, taking care of
Right.
people with chronic mental illness. I feel one of my responsibilities is to support people in leadership like yourself to not just ensure that you understand the people that are suffering and wanting better treatments, but also appreciating the challenges that you have in your position, balancing so many different forces from stigma and support. Um, how do you feel we as mental health practitioners can better help you do the work that you do so you can keep that creativity that brought you into mental health?
Yeah, that's a great question, Dr.
Yeah.
Vera.
Yeah.
I think that if collaboration is key,
Mhm.
and we really need to understand what's happening on the line, what's happening with direct patient care, so that we can then have policy that goes along with it.
Mhm.
And that we should stop pointing fingers at
Yeah.
each other. And
Right.
I don't think we do that at all.
Yeah.
But I think in the grand structure of healthcare in the nation, and in
Mhm.
particular in the state of California, there is a lot of blaming
Right.
that you didn't do this or you should have done this better. And I always think about it in the way we work with oncology.
Right.
So nobody blames an oncologist for cancer
Right.
because the job is to help treat
Yeah.
and get someone into remission in cancer. But in behavioral health, I think that that's not really defined in the same way. And that sometimes we as behavioral health clinicians are often blamed
Mhm.
for not doing more.
Right.
And so I think if we work together, really focusing maybe on more prevention, holding our other partners as accountable as we are held, I
Mhm.
think that can really help change the trajectory of the way we address and treat behavioral health issues.
Okay. In in the leadership roles that you've been involved in over the past many, many years, do you think we're getting closer to that? Are we, or do two steps forward, one and a half back? Or, you know, what's your sense? You know, are you optimistic as you're moving forward?
I am optimistic, but I
Okay.
will say it is two steps forward and one step back.
Yeah.
But I
Okay.
think anything worth
Hmm.
changing and moving forward will have that
Hmm.
process in place. I think that we have partners that we've been working with so differently than we have in the past.
Okay.
So we're not so hierarchical because there was a time when I would never have spoken to you, Dr. Bera,
Yeah.
or even thought to call you Ramal
Okay.
outside the workspace. I would never have done that. But
Hmm.
I think now we have different disciplines that work together. including peers. So people with a lived experience, I think that really helps. And then the fact that we're partnering with our university partners from the county perspective, from the public system, that's essential. And I think in the past, we very much stayed siloed.
Sure.
You all stay there and do academia, and we'll
Right.
do the real work. And that's
Yeah.
ridiculous because we are both doing the real work
Right.
and we both can share our expertise. And I'm really so thankful that UCI has the program that you have in place with training new trainers, because we have to expand our workforce.
Right.
And if we don't, we will never get ahead of the concerns we're seeing socially with behavioral health issues.
Okay. You mentioned having peers and having peers share their experience, that shared experience. How, that's an area I fully believe in, that the people and the families that are living these illnesses day to day need to be better engaged.
Right.
And I know, the Orange County Healthcare uh, Administration is very engaged in that. How can we do better in making it an open door that we need you to be part of this treatment
Right.
team?
I think saying what you just said, but saying it all over social
Yeah.
media, in the press, using research as an opportunity to include people with lived experience to help inform, to participate more. So, participatory action research, I think that's going to help us. We as clinicians know one side of the coin, and we as family members know another side, but there
Right.
is other things happening there. And to have someone who's actually experienced what it's like to be put on a 5150 hold,
Right.
to take medication that might just provide them with extreme side effects, being isolated from other folks, we need to hear that. And we need to, I think, empower people with lived experience, such that if I were a person with lived experience, that I should feel as comfortable sharing my own history as I do sharing about my sciatica. I talk all about my sciatica,
Yeah.
but most of us will not talk about our issues with alcohol or our depression or our manic swings. That is more taboo. And I think once we shift that and really highlight the importance of the lived experience, I think we'll make big strides.
Okay. Yeah. You probably do a lot of work with like school districts and so forth. What's your sense and how we're supporting schools and education and awareness of depression, substance abuse, um, psychotic illnesses? Are schools more receptive, and are we doing a better job at that, really earlier age?
Yeah, I would say yes and yes.
Okay.
I
Yeah.
think we got a big boost from COVID. The
Okay.
pandemic really reminded people that, oh my gosh, we all have mental health and we all want to keep it.
Yeah.
And that includes our kids. We were most concerned about that. At the same time, we had the opioid epidemic hit us. And so we really started to look more about substance use and why our kids are buying pills or buying an Adderall on Snapchat. Why are they doing that?
Right.
So I think that's really assisted us. I think schools are far more open
Okay.
because what they see is they'll have a child and a family who's impacted in the classroom, and they
Right.
see it, but they're not trained to deal
Right.
with it.
Right.
So I think the marriage between, again, academia and direct practice is our entree into the school system. So I think we're doing much better.
Okay. And in your position of leadership, when you're looking year to year as to where to allocate resources and make sure things are justified, cost effective, you're using, limited healthcare dollars wisely. How do you navigate that? I mean, I can't imagine, here's the budget and I've got to do my best to serve all these, the healthcare of this large county.
Yeah.
I mean, how do you begin to even navigate that?
With a hope and a prayer.
With the hope and prayer, right?
I think it's really looking at the entire healthcare system.
Okay.
So it can't just be about mental health. It can't just be about substance use disorder. We have public health services and correctional health services and employee health services and the public guardian. We have all of these different parts. We have to address prevention at the same time we're addressing recovery support. So when I'm looking at making those really hard decisions, I'm balancing regulatory mandates, trying to be as creative as possible, and then our limited resources. But in order to really make our system work, we need partners. We need outside partners. We need universities, certainly, but we need private providers, and we need commercial insurance providers to come to the table so that we can really develop an effective system of care.
Okay. What keeps you up at night?
So many
I mean,
things.
within the workspace or even outside the workspace.
Yeah.
But
How much time do we have?
yeah, right. Yeah, I mean, like, are there like particular areas that you're just, I, we got to figure out how to do this, and I want to do it under my term as a leader. What, are there some, specific areas that I know we can do it, but I've got to just figure out the way and the right people that will get that done. Are there some things that come to mind?
Yeah, workforce is the number one. That
Okay.
absolutely keeps me up
Yeah.
at night. With the mass exodus we had in healthcare
Yeah.
following the pandemic, and the challenge of getting people to come and want to do this really difficult work.
Right.
The people who, like ourselves
Yeah.
and the people that we work with, are mission driven.
Right.
We could be doing a whole lot of other things, but this is where we, feed our souls and where we can
Yeah.
help serve folks. So, how do we address workforce? That's important, and we have to change. I think that's why we look at peers. That can be an effective way to fill a role in helping someone, partner with them through the process of recovery. And also that we don't just stay in our silos. I'm a social worker, but I have a lot of things I can do as a social worker, right? As a clinician, as a diagnostician. In the same way, our physician workforce, we have so many primary care physicians who see our patients every day, yet they're not addressing necessarily the underlying addiction
Right.
or the underlying mental health concern, because that might not be their training.
Yeah.
So to really lean into that and help provide, as you all are doing, getting people certified so that they're comfortable, that they have consultants that they can talk about, that's where we're going to hit it. Because again, if I have a suspicious mole on my
Yeah.
arm and I have melanoma or cancer in my family, I'm not going to an oncologist.
Right.
I'm going to my primary care doctor, and that person should help move me there, and they do. But if I can't get out of bed and I'm finding I'm drinking a lot of alcohol all the time and I'm losing my job and I go to my primary care doctor, I want them to connect me with a specialist. I want them to start the process because that's my primary care doc.
Right.
I think that is part of the answer. And then also just sharing our own lived experience. Again, like I said, that we complain about all of our physical health ailments. Let's start to talk about our substance use concerns and our mental health issues so that we normalize the conversation, so that folks coming up, kids, adolescents, want to come into this space. Like they understand it. I think we are on a precipice right now because it's such a crisis for workforce that we can really change things.
Okay. Yeah, no, I like that sort of holistic, it's a word we overuse, I think,
Yes.
sometimes, but it really is holistic, bringing everyone in, because mental illness is like physical illness, but it's also quite different.
Absolutely.
Um, it's sort of amorphous and it moves around, and it's even as a clinician to really pinpoint what's going on. Um, but it's allowing somebody to share that story of what they're experiencing, and that's really a first step to really understand, how you might be able to help somebody. Um, how do you keep yourself well within the work setting, outside the work setting? To keep that passion that you're sharing, you know, even stronger as you go further in your career. What keeps you well?
Well, a lot of things.
Okay.
I understand the importance, but physician heal thyself.
Yeah.
I think providers are not the best
Right.
at making sure we're
Yeah.
okay. But I spend a lot of time, really dedicated time to making sure I do things that are fun for me.
Okay.
So teaching is super fun for me.
Okay.
I know it says a lot about me that that's my fun thing, but
Yeah.
I really love that, and that really, like, that also feeds my soul. But I like my family, so I
Mhm.
like hanging out with my
Yeah.
family. I have a grandson; he's 5, and he totally keeps me active. And I come from a family of addiction,
Okay.
and so seeing where my siblings have all been,
Okay.
And I also have a daughter who's in recovery from an opioid use disorder. Being in connection with her and her recovery, it just keeps me focused. It reminds me about the lived experience that I have a responsibility. Um, I like to get my nails done.
Okay. Yeah.
I like to. We live near the coast, so I go to the beach and I do a lot of walking, and I like to spend time with family and friends. So I think all of that kind of helps balance it out. But I know because, and you're the same kind of
Yeah.
person. This is who I am,
Yeah.
and so it's always part of my everyday thought about how I can help other folks. But that does help me. But I
Yeah.
also try and get more than 5 hours of sleep a night,
Right.
but that really doesn't
Yeah.
work out so well.
Yeah. You're right. We really are in a privileged area of work where we can talk to people and hear people's stories. Um, I sometimes, wish I could do this more,
Yeah,
hear the stories. And I think that's why, as you said, we came into a field like this. I mean, we become better people, when we learn from others. Um, and I'm sure in all the work you've done, uh, not just helping others, but you become a better person.
absolutely. I hope so.
And yeah,
Yeah.
right. I mean, that's the human
Right.
experience. Yeah. Um, Ronnie, I asked a little earlier, as you look at the next 2 or 3 years, within Orange County, are there, specific ideas or programs you would like all of us as colleagues to help you with, or open more doors so you can achieve what is clearly, I'm sure, an ideal goal? How can we help you
Yeah.
in what you're doing?
Well, in the next few years, we're sort of in a budgetary crisis,
Right,
and
right,
perhaps we have new administrations coming in, and there's
right.
going to be probably significant change. I never like to let a good crisis go to waste, and I think
Okay,
now's
yeah,
the time. If you look at our behavioral health system, and you are very well aware of
yeah,
this, our system has been crafted by legislators. They
right,
create the policy, and
right,
unfortunately, not many of them are psychiatrists or
right.
social workers.
Sure.
And so we're left with a system that somebody else crafted for some other folks,
Okay,
and we haven't been at the table. So
okay,
I think this is a chance for us to work together, perhaps
okay,
on legislation,
okay,
and use this crisis as a way to create a system that we really want. We know what works.
okay.
The people we serve and the families we serve know what works.
Hmm.
And no disrespect, but I don't know that a lawyer in Sacramento necessarily
Right,
knows what works. So
right,
now's the time. We have probably 2 to 4 years to take the bull by the horns and really shift things. That if we want more effective step down programs,
hmm,
if we want to change the way people receive care, that it's not
yeah,
necessarily in institutions, that it's in community, now is our time. We can, I think, also leverage our concerns with unhoused people
right,
and that crisis to bring communities together so we can actually re enter them and provide care more effectively than just putting us out in state hospitals.
yeah,
Now's the time.
right. I, that made me think, in your role in leadership, you know, as a psychiatrist that's very involved in like advocacy and policy, I think we can do a better job with our healthcare dollars. It's easy to keep asking, like Sacramento, oh, we need more, we need more. But I'm of the belief with the monies we have, we can use it more wisely.
Agreed.
Maybe divert from a program that's maybe not getting us the bang for the buck. What are your thoughts on that? Maybe not asking for more and more, but let's utilize what we have maybe in a more creative fashion. Like be honest with ourselves if something's not working.
Right. And that is exactly
Yeah,
what we've been doing
yeah,
because we don't have a lot of funds. We
right,
will never have enough funds.
right, right.
So we've used in the county a decision matrix and we've looked at every aspect of a
Yeah,
program. How many people are served?
yeah,
Are they billing for services? So are these billable services? What are the performance outcomes? Are people
yeah,
getting better? Do people report that they feel better,
right.
that their disease is more stable, that
Hmm.
they feel more in control of their lives? Looking at all of that and weighing each of those categories. And the programs that we've been told to do by someone,
Yeah,
a
right,
lawyer,
right. Yeah, yeah,
we're cutting.
yeah.
Programs that aren't producing outcomes, we're
Okay.
cutting. And what we've found is that some of the programs we've been doing for 20, 30 years, and they've never been effective.
Okay.
But there was a statute written
Yeah.
that said we have to do this. And so again, that's where we have to be brave
Right.
and get in front of this and get to our legislators and change policy. We have to do both of those things.
Mhm.
And then I think we can use our funding far more effectively. But
Okay.
I will say behavioral health is not funded at the same level
Right.
that physical health care is. And it's in the same body. So it doesn't
Yeah.
make any sense.
Right.
I mean, the head's really important. So we should fund services for that.
Yeah.
We should fund, be able to get reimbursement from private insurance and from public insurance for all levels of a provider,
Mhm.
not just the highest level of a physician.
Right.
Physicians are great. We
Yeah.
can't do things without you all,
Sure.
but other clinical folks are
Sure.
just as important.
Absolutely.
And that will help us, again, expand our workforce. It will
Yeah.
help us get services out very differently than we currently do.
Yeah. And in some ways, I think the mental health space, those other healthcare providers, it's a space that you can develop an expertise that is quite different than
Right.
a surgeon or obstetrician.
Exactly.
I think in mental health, we can have a larger group of health professionals that can can help us reach where we want to be.
Right.
Absolutely, and I know there's often butting heads by even within this field, but we have to look at ourselves and say, no, we need to embrace a larger workforce within mental health, and they're going to provide a very important service so we can reach everybody.
Yeah.
Yeah. Um, do you think we're doing a little bit better job with legislators today? Like they're more receptive when we go to them and help support them in understanding, you know, why this adjustment or direction will lead to a better outcome and maybe save monies. Uh, do you think there's a little bit more receptiveness to the people making some of these important decisions?
Yeah, I think that's a great point because our legislators, they want to carry bills. They
Yeah,
want to make a change
right,
and they're not in our space. So we have to go to
yeah,
them more.
right,
I often hear about legislators saying, "Is there anything I can do? Is there any bills you'd want us to
yeah,
work on?" And if we went together to that
yeah,
ledge person, I think that would be more effective. That we're bringing academia, that we're bringing different levels of professionals, that we're bringing the public system, that we're all coming together. That would be really effective. But I do think, again, because of the shift with COVID and a
mhm,
focus on the fact that, oh my gosh, we all have mental health, we want to keep it kind of thing. I think everyone is really open. I think the place that we need to get in there before other politicians get in there and
okay,
politicize health,
right,
because then that just takes us back 20 years. But I think that, again, that the time is now.
okay, good. Ronnie, I know you've done a lot of work, helping educate law enforcement, often the first people, at, a traumatic, emergent event taking place on the streets, in somebody's home. Um, Tell me a little bit about law enforcement. I feel they're just very receptive to wanting to understand mental illness, and they're empathic. Uh, I know sometimes there's a bad name or a bad event takes place that gets really highlighted, but I've been very impressed with law enforcement and its empathy and sympathy toward mental illness. And I know you do a lot of work there and a lot of training
Right.
in your position. What more can we do to help you and help law enforcement, and appreciate the real challenge they have being the first, you know, responder for a
Right.
mental health crisis?
Yeah, I think the tide has shifted a little bit so that, again, we don't want to put a law enforcement officer in a
Mm,
position where they will have to do something that can't be undone.
right.
And so I think working together with them, doing our crisis intervention
Yeah.
trainings that we do with law enforcement, we do it here in Orange County together with law enforcement.
Okay.
And all folks going through the Sheriff Academy, they all get the training,
Hmm.
and field officers get the training. And that just teaches them how to respond if they respond to a crisis and someone is clearly having a mental health impact.
Okay.
So they know, like, stop shouting at them. If I
Right.
have a lot of voices in my head already and I'm agitated, I can't hear you give me a
Mm-hmm.
command, right? So, and if 5 of you show up with your badges and your
Right.
guns, I'm going to get more paranoid and more agitated. I think any of us would.
Right.
So the training that we do with them,
Mm-hmm.
with the officers, is very helpful. And I'll tell you, the part of our training that we do, and this is national
Yeah.
curriculum, but the part that we do that's been the most effective
Mm.
per our law enforcement partners is when people who have mental illness
Right.
sit on a panel and talk to the officers about what it was like for them when they were arrested,
Okay.
when they were incarcerated. And I've seen officers
Mm-hmm.
actually break down in tears during that because they also are people who have family members
Right.
who have lived
Yeah.
experience and they know what that's like. We've also taken, and I think that's great to do that
Yeah.
for law enforcement in that perspective. The nation is going towards separate response
Right.
so that clinicians go first,
Right.
separate. And if it's a call where there might be a weapon involved, absolutely law enforcement should come
Mm-hmm.
along, but they should be CIT, crisis intervention trained. Um, so that's really helpful. But also, the next level up of law enforcement, our district attorneys, our public defenders, our judges,
Mm-hmm.
those folks to understand what is happening. And when an individual is brought into their courtroom or that they're going to defend or prosecute someone, that they understand what is actually happening, the health impacts. And again, having been in part of the training where we have trained in San Bernardino
Yeah.
County, we trained all of our, uh, our DAs and public
Right.
defenders. We had significant response during CIT training.
Yeah.
Really, they just turned a corner because they hadn't thought about these as folks who are struggling with an illness. They just saw them as being someone who broke a law.
Yeah.
So I think we're we're going in the right way. Well, I think though we have to do everything sort of tempered so that I would never send a clinician singly by themselves out to a domestic violence
Right.
incident.
Mm.
We roll in teams of 2 all the time, and our clinicians are always trained in nonviolent crisis intervention, how to defend themselves, that sort of thing. But it's a collaboration between the clinician and law enforcement. And we've done a really
Yeah.
good job, I think, in Orange County. We've just trained our 911 dispatchers
Okay.
on how to differentiate a call. It's a behavioral health call so that they can divert it over to our crisis assessment team and they go and they
Okay.
can do the assessment.
Is that something, that training, is it monthly? Is it quarterly? Or,
Yeah.
and they can like have almost like a debriefing. Oh, these are the instances we had, and it's an ongoing where that you know that police agency, that you're going there regularly, or
Yeah, we have a CIT committee, and
okay,
it's equal law enforcement and
yeah,
clinicians, and we meet with all of our jurisdictions. We meet monthly. We meet more than that if we need to,
okay,
but we have a very good relationship with our sheriff and
yeah,
all of our local police departments,
right,
and you have to keep that up.
yeah,
I often joked when I was in another county in San
yeah,
Bernardino County that law enforcement called us the tree huggers, and we called them the knuckle draggers, but we knew that we each had something that the other
yeah,
needed, and that brought us together. And I see that here in Orange County as
yeah.
well.
That made me just think of sort of a really creative idea. They're essentially healthcare providers also, not just mental health, but if there's a heart attack or an asthma attack, there's a 911 call, they're going too, along with the paramedic. What about like in medical education? We have weekly grand rounds or,
Right.
monthly case discussions. What if we went to you know, the police office and almost a quarterly, you know, lecture on depression, suicide, where they could share, they uh, just providing didactics. I mean, do you think something like that
Absolutely.
could
Yeah,
go
I think
far?
that would be exciting. They
Yeah.
they want the information.
Right.
And the chiefs and the sheriff
Yeah.
have an organization in Orange County where they do have these meetings, and
Yeah.
we could probably hit on the agenda
Right.
so that we could do this.
Yeah,
And they know what they're seeing on the street,
exactly.
right? We don't know.
No.
But to have them ask questions, and also, I mean, that really brings in the substance use disorder
Yeah.
piece, because they might not understand how
Right.
substances are being used, what happens
Yeah.
physiologically. I think it's a great opportunity,
Yeah.
and that would be a great partnership.
Yeah, and I think it'd make us better clinicians
I agree.
hearing their story and what they're seeing. So we're also better prepared when that person comes to
into
us, be it in the
exactly.
emergency room or in the
Yeah.
hospital. Um, yeah,
Yeah. Then we'd
so
all be on the same team.
exactly. And it, I think it'll make us feel that we're doing more than just day-to-day clinical. We're really, broadening really what the expectation of us as, mental health experts is.
Yeah. And that
So,
broadens our workforce.
yeah,
That way they can
absolutely,
help us.
absolutely.
Yeah.
I mean, yeah, we got to think outside the box.
Exactly.
They are part of our workforce,
Yeah.
and if they become skilled, we're helping more people.
Exactly. Yeah.
And yeah.
Yeah. Great idea.
Yeah, right. Well, Ronnie, thank you so much for, really broadening why I do the work I do, and for the others to really, hear that, we're all in this together. Um, any final thoughts that you'd like to share, um, in ensuring that we all, work together and approach each other and, feel that we're all we have the same mission of where we want to be. Any final thoughts that come to your mind?
Yeah. I think we're all on the same team,
Yeah,
and we have to stop guarding our territory.
you
If
know,
we work together, we will be able to impact far more change than if we just did our thing over in the county and you did yours at UCI and the hospital stayed over there. We have to all work together.
okay, yeah. And, if people want to be more engaged in the various healthcare committees who are citizens or people who have shared experiences, any thoughts as to what I can do as a clinician to guide them into, helping the broader mental health space in Orange County?
We are always looking for people
Okay,
to come into our field.
okay,
So, OCHealthInfo.com is
okay,
our county's website that takes you to the healthcare agency. And then we have an online platform called the
okay.
OC Navigator, so
Right,
ocnavigator.org, where you can go on and find out all sorts of information about
okay,
resources in our county, but also educational and supportive information. So, if you want to know more about
okay,
depression, or if you want to find an eating disorder treatment
okay,
facility near you, all of that's there, and our resources are free.
okay. And if somebody wanted to get engaged to help others, maybe volunteer, that site would sort of help, direct them.
Yes.
Yeah. So I think that's a place we can do a better job also
Yeah.
of, you know, directing people towards, take a look at this.
Yeah.
There may be something there that resonates with what you're going through, or, where you'd like to have some role or impact. Well, very good. That's, you know, I'm glad we ended on that. That's an important piece. Thank you.
Thank you very much for the
You
opportunity.
bet.